25 sickest patients have died in the last 24 hours at Sir Ganga Ram Hospital in Delhi. A statement from the hospital said this morning, revealing a worsening COVID crisis in the capital's hospitals. In an SOS at around 8 a.m., the hospital also said it only had oxygen for 2 more hours and that 60 more patients were at risk. Around 2 hours later, oxygen tankers arrived at the hospital, and the hospital also said it needed oxygen to be airlifted urgently, but its top officers contradicted each other on whether the deaths, all of critical COVID patients, were because of oxygen shortage. My colleague Saurabh Shukla spoke with the chairman of Ganga Ram Hospital a short while ago. Let's listen in.
In the morning, we've got a news that 25 patients, critical patients, died in Ganga Ram. Is this due to lack of oxygen supply?
That is not true. They have not died because we were not having oxygen. We are maintaining oxygen supply at lower level, and there have been no deaths because there is no oxygen at all. And that point has not yet come because state government and central government, they are ensuring a constant supply, though at a low level. And we have even now we have got supply which will last about 4 to 6 hours further. And by that time, state government has already ensured that another supply will come. Supply is coming in a small amount actually, and that is probably their compulsion because they are not able to give it so far. But I think today there will be a lot of positive effect since Prime Minister of the country had taken yesterday steps that they will ensure supply chain will be very smooth, so that there is no prevention of these drugs etc. at a border. So let us hope for the best, and there will be increased production of the.
So there is no low pressure as well?
No, low pressure is there, then we check. We are able to, we know that there is a crisis. So low pressure, sometimes some people we are giving manual help.
So how these 25 people died, sir?
Most of them died because they are having very severe cardiac, severe disease actually, and existing comorbid conditions. Apart from that, many people died in the casualty. They could not get any oxygen. They could not be taken inside it.
Okay, they died outside.
They died outside, without that, or they died outside, so they were coming under our strength.
So now you have got some amount of oxygen. So till when it is going to last?
Maybe for 5 to 6 hours.
5 to 6 hours.
And before that, government said that we will replace.